Hello, welcome to the CIRS Healing Collective expert guest video series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a shoemaker proficiency partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you. So tell us exactly, what is MoldCo, and what would you say is like maybe the mission and vision of MoldCo, and then we'll get into the details.
Yeah, so MoldCo is a healthcare platform. It's the first of its kind. So there's still a lot that we're learning, and we're moving really slowly and intentionally to first delight our first 100 patients and make sure the platform is meets our standards and meets the patient standards. But what we're offering is a direct clinician that's shoemaker certified or mold certified, in this kind of concierge way, which includes synchronous visits. So just like this, a Zoom call where you can chat with the clinician, as well as asynchronous where you can message the clinician online. We have all the prescription medications on the platform, and we worked with our pharmacy providers to get that at quite a low cost, actually lower cost than several of the shoemaker certified clinicians today. And then we worked with a lab integration to have very discounted labs for both LabCorp and Quest. For example, we have the key biomarkers MSH, MMP9, TGF-beta1 for just $99 self-pay. Typically, that's closer to $657 self-pay. So with or without insurance, this is fairly low cost. We try to get it as low cost as possible, somewhere between all in, between the meds and the labs and the clinician time and the platform access, between $200 to $400 per month. And at scale, we want to get that even lower over time. And that's with the direct to consumer model. We're also exploring integrating directly with clinicians in the clinics too. So we have a pilot going now actually with a free clinic based in Florida. So it'll actually be free medications and free care for lower income patients.
Okay. All right. So MoldCo is a digital platform where people who know they have CIRS or maybe think they have CIRS can pay a monthly rate. I think you said up to maybe $400, and they have access to medical care digitally and discounted labs, discounted, binders and treatments. Am I understanding that right so far?
Yeah, so it includes colesevelam, so the more gentler binder that's an oral medication and just easier to take for patients. And the second step is an EDTA biofilm disruptor nasal spray with high quality ingredients directly from the compounding pharmacy. And the last step is VIP. And we got the cost of VIP quite low. And it also includes the ongoing maintenance dose of EDTA to ensure that MARCON stays at bay. And the $400 price point would be inclusive of labs, the VIP, and the ongoing EDTA spray and the clinician care. So that's on the upper end. Whereas like on the lower end, we would see like closer to $200. So it really just depends on which step you're at with the protocol. Okay. And we're going to also keep testing the pricing too. So far, the feedback has been pretty accepting for that price point, just because the current options today are quite a bit more expensive. So we'll continue to iterate just because we're a startup and we're here to learn, figure out what's scalable.
Okay, so it's not so much a monthly membership with a set fee, but it kind of depends on what you're doing that month, what treatments you're on, what labs you're needing to do. So, but on the higher end, $400 a month-ish, yeah, which is really reasonable. Okay, this sounds amazing. Tell us more about how the medical I guess care is actually delivered. When you said there's a synchronous face, I'm not sure what that is. What I see, if you were my doctor, would I be looking at you like this right now? Or is it more like a group visit or a bot, or like, are you really talking with a live doctor?
Yeah, a live NP that's licensed in the state that you're in. Right now, we're licensed in Texas and Florida, and it would be a one-on-one synchronous visit using actually our Zoom integration. So it would look pretty much exactly like this to meet with a clinician. And over time, we do want to see if it's possible to remove that step, mainly because it saves patients money, just because we're able to reduce that cost basis. But I think for some of these more complex cases, a synchronous visit would still be needed. It's just the majority of the patients we've noticed is a little bit more cookie cutter and templatized. And we're also servicing patients we don't have a term for it yet, but it's pre-CIRS, where you're symptomatic from being in your environment, but it hasn't yet developed into being a chronic illness. So almost nipping it in the bud before it gets exacerbated. We've had interest from these biohacking and longevity groups too, but I'm a little hesitant to have our clinicians prescribe medications for already healthy people for the detox purposes. Like, I think that just needs a little bit more time and attention into understanding if that makes sense.
That's amazing. So we don't even have to be basically a patient of, a MoldCo doctor. We can come on and buy that kit. And it doesn't have to be our doctor. We can do it as the patient. And then I guess, do you give us a script that then we take to LabCorp or Quest or something?
Yeah, we'll also have an option to have an at-home phlebotomist soon too. Just for the initial patients, we're keeping it simple, and it's a lab order to LabCorp. And it also comes with pretty detailed educational content too, like what does low range mean, medium range, high range, and how to interpret the reference ranges. So you don't have to essentially spend money meeting with a clinician. You can read the educational materials and just learn more about how to read your results. So it's kind of DIY doctor, but yeah.
Are you going to include tick-borne care,
Yeah.
or is that an exclusion?
So the parent company, excuse me, the parent company name is actually the Immune Co.
Okay.
And our intention is actually to expand into tick-borne illnesses and long COVID, just for a few reasons. One, and this carries a bit of risk. This does need some more R&D, but um, there seems to be an underlying pathway of how these illnesses show up in the body, and it seems to be pretty similar. And this is more anecdotal. I haven't seen a lot of published evidence yet, but patients with the tick-borne illnesses and long COVID seem to have some resolution going through the Shoemaker protocol. There probably does need to be some changes.
Right. Wow. Well, that's amazing and exciting that, some of the directions that you may take this in the future. So tell me, a big part of the Shoemaker protocol and a big hurdle that so many of us have experienced is the environmental component. So if we're still in exposure, are we excluded? Or do you support people in figuring out where they're getting exposed and getting out of exposure? How are you addressing that component?
Yeah, so the philosophy our clinician team has landed on is that it's better to start treating patients even when they're in the environment, just so that they can start getting better. So that's our approach. So you can start treatment even when you're in the environment. There are certain steps that are excluded though, just for patient safety. And in terms of helping patients navigate the environment, we've set up an affiliate partnership with a dust test provider. We're collecting a list of IEPs that are high signal, especially at a clinical level for patients. So not just folks that do the required steps, but above and beyond that for these more sensitive patient types. And then also we've been producing content too, and it's been more lighter touch, like nowhere near the content that you've made for your community, but just super simple steps about how to break your lease or a cure notice if you're a renter, and then how to manage your environment if you're not able to leave your environment or can't yet afford remediation services. So, for example, having a standalone AC unit if it's in your HVAC system, and leaving the window open, and having an Air Oasis air purifier that has the bipolar ionization technology and has like third-party data to support that it can get rid of these, the melange of different microbes in your ecosystem. So we have some of these steps in the content, but We do need to build out more of the environmental support side, and we're meeting with more environmental professionals to build out more of that content too.
Walking through the patient experience. And from what I'm understanding, there's this intake. You'll find out if you're included or excluded. You'll get assigned a clinician, a nurse practitioner who is certified, and maybe a modified version of the Shoemaker protocol, but one that's been approved by Shoemaker and McMahon. And they're discounted labs and medical treatment with some, what would you call it? Not the brand name of like colesevelam instead of WellCall, like using some of the generic brands and some of the discounts that you're able to get. And you pay, $200 to $400 ish a month
Yep.
for this discounted care. And there's some environmental support, access to dust samples, access to resources, access to information to be able to figure out how to get out of exposure. Texas and Florida so far. What are
Yep.
your plans for expansion? How fast might other states be added in there? Tell us more about that.
It'll just depend on demand. We're also setting up New York right now too, which takes some time just because it's a more complicated state to launch in. But it's also a strong mold state for us. So we've been tracking interested folks through our wait list, and I've been noting the top mold states. So far, it's been Texas and Florida, then New York. So we prioritize those states. I think if there's strong interest or even a clinic integration, we can ramp up another state. We have pretty well licensed clinicians on our clinical team. So there isn't really a bottleneck in getting licenses, more so setting up the paperwork and then expanding the software logic to include those states.